Those of you who are just joining, we're going to give it a few minutes and so that everyone can log in. In the meantime, just drop your name and your organization in the chat, please.
Before we get started, I just want to say thank you to Chris from COIC for helping us drive the meeting today. We really appreciate your tech support, Chris.
Do my best.
Great. So I think we'll kick off the meeting. My name is Eliza Wilson. For those of you who don't know me, I work for JBARJ Youth Services as Program Director of Runaway and Homeless Youth Services, and am on the HLC board, and I'm serving as the interim chair for the HLC. I just wanted to start off the meeting by thanking everyone who participated in the point in time count last week. This year was kind of tough. You know, we had the recent surge of COVID and had some folks out, and that made it particularly difficult. Even just with JBARJ, we did have some folks out due to COVID. So we persisted and, you know, did what we could. And I think I just feel grateful for all of your hard work and working through that in such a difficult time. Today, we're going to hear from a couple presenters. We'll start off with Dana Richards. She's the Unhoused Services Manager with NeighborImpact.
Hi, good morning. Thank you, Eliza. I'm going to go ahead and share my screen. Can you all see the Built for Xero presentation? Awesome, thank you. A little bit of background. Like she said, I'm Dana Richards. I use she, her pronouns, and I'm the Unhoused Services Manager at NeighborImpact. And I've also been acting as the Central Oregon Cohort Improvement Team Lead after Colleen Thomas, who started this with a team of folks that I believe included Eliza and Gwen, and I believe Donna from Family Kitchen. And they did a lot of work leading up to where we are now, figuring out if it would be a good fit for Central Oregon. So really thank that crew of people. So today I'm going to give a little overview of Built for Xero. I have been in some meetings with some of you folks, for instance, Redmond Service Providers or Sisters. So some of it might be a little bit of a review, but Lindsay had asked if I could kind of show people where we've been so far. So that's my intent for today, and also to do a little call for folks to be involved as part of the improvement team. So Built for Xero is a movement. It's committed to, here, let me go to the next step. Here we go. So it's a movement committed to measurably ending homelessness. And I said this is something that we joined this year in the fall of 2021. The folks at Built for Xero have created a methodology that utilizes data to measurably end homelessness. So we're not actually ending it, but it's a formula, which I'll get into later, and hopefully not get too into the weeds with confusing numbers, but it's a notion known as functional zero. And ultimately, Built for Xero is the process and the method that allows Central Oregon to look at our houseless response systems and the way that we gather data, such as our homeless management information system, also known as HMIS, also known as Service Point or WellSky that some of you are familiar with, and our coordinated entry system and case conferencing that some of you participate in and are familiar with. And thank you so much to all folks involved with that. And, you know, to make our houselessness in our region rare and brief for a population is the end goal. So I'm going to go ahead and share a video that some folks may have seen in previous meetings, but the good news is I know how to make the sound work now.
Can you imagine living in a community that has solved homelessness? A world where when an emergency arises, a person can get the support they need to remain in housing. And if they ever lose their home, they are moved into housing quickly by a system that knows them and what they need. Homelessness is rare, brief when it happens, and never becomes a way of life. The truth is, we don't have to just imagine it. In the Gulf Coast region of Mississippi, any veteran who becomes homeless is connected to housing within 30 days of identification. No one's left behind. And they aren't the only ones. Across the country, communities in Built for Zero are proving that homelessness is solvable. They do it by shifting their methodology and their mindset. First, they build a single team that is accountable for ending homelessness across the community. Who's responsible for ending homelessness in your community? The truth is, many stakeholders hold a piece of the solution, but no one has their eye on how the pieces fit together. In Built for Zero communities, everyone who serves the population works together to align their collective efforts behind a shared goal. Second, they commit to a shared aim of ending homelessness. Often, success for those working on homelessness is defined by how their individual programs perform. Built for Zero communities measure progress by whether they are collectively driving down the number of people experiencing homelessness. Their goal is to reach functional zero, a dynamic milestone that ensures homelessness stays rare and brief. Are fewer people experiencing homelessness than can be routinely housed? Once they reach functional zero for veterans or people experiencing chronic homelessness, they work to sustain it and scale that learning to the next population, until their systems are built to end homelessness for all. Third, they know everyone experiencing homelessness by name and in real time. You can't solve a problem that you can't see, and homelessness is a dynamic problem that is constantly changing. But it's often tracked using an annual anonymous street count, which is just a snapshot. To end homelessness, a community needs a video. Built for Zero communities maintain by-name data on who's experiencing homelessness in real time. They understand not only every individual's needs, but the dynamics of the population as a whole. They know who is entering homelessness, who is actively experiencing it, and who is exiting it. That way, they can target where systems can be improved, test new ideas, and track whether their efforts are actually driving numbers down. Finally, they make data-driven targeted investments. Expanding housing resources is crucial, but many cities have dramatically done so without making a dent in homelessness. The reason? They never fixed the housing system. Real-time data enables communities to secure and target housing resources to drive the greatest possible reductions in homelessness. Homelessness is a big and complex problem, but it's not too big or complex to be solved. While it affects those who experience it in the deepest way, it affects less than 1% of the population. Communities can build systems that continually eliminate it and ensure everyone has a place to call home and live with dignity. We can take steps together toward a future where homelessness being rare and brief is the norm, not the exception. Is your community a part of it?
Okay, great. So I'm going to elaborate on that video a little bit. Functional zero, which is the goal, the data goal for the movement of Built for Zero. We as a community are working towards achieving and sustaining this functional zero data measure. And we as a community will start by focusing on creating coordinated, data-driven systems capable of ending houselessness for a specific population, as they mentioned in their chronic homelessness, folks who are veterans that are experiencing homelessness, and then going on from there, with the goal of applying this progress to all populations, as it was sharing. So this is the measure, and I'm not going to go into this too specifically. I just wanted you guys to have a visual of the formula that Built for Zero has come up with for folks who are chronically homeless. And if this is a new term for you, I just want to share that this is folks who have experienced homelessness for at least 1 year or have had 4 episodes within 3 years that are also experiencing a disability. And then this is the formula they have for folks who are veterans. Just that on both cases that folks who are actively experiencing homelessness are less than or equal to our housing placement rate. And so these are the definitions that Built for Zero has come up with, but they're working on definitions for families, youth, and single adults and folks who experience all houselessness. And but as that video was sharing, is that by applying this to the populations who are experiencing chronic homelessness or the populations who are veterans experiencing homelessness, that we can then apply that to the rest of the system. And this just grows on already the great work that we do through use of HMIS, through the amazing PIT count, which Eliza mentioned, which is so important, but as the video shared, is a snapshot. And so this system that we're working to put in place would, at a bare minimum, go through our whole, what we're going to be creating is a by name list, which already exists in a form through coordinated entry. But by going through that bare minimum monthly, so we all, so it's updated bare minimum 12 times a year, possibly more, instead of just having that one week of point in time count. So I'm going to explain the process a little bit. First, it's a shared measurable goal. So we've decided that we're either going to focus on folks experiencing chronic houselessness or folks who are veterans who are experiencing houselessness. And from there, which is where we are currently, we're building what's called a command center, but it's really our improvement team, which is the cohort we're in right now, which I'll go into more later. But this is everyone who touches folks experiencing houselessness. Like, we would love folks who are in nonprofits to be part of this, housing authority, local government, folks that work with veterans, or the Veterans Administration, our vast continuum of care, and working toward a shared definition of zero, and working towards really utilizing the resources that we have to work with the folks who are experiencing houselessness to help get them housed. Next, we would have a quality data system. And so working to develop real-time person-specific data systems, measuring inflow, active houselessness, and outflow, which was also in the video. So then we can really understand who in our region here in Central Oregon is experiencing houselessness, and how our system is performing, where we can make improvements, where it's excelling, and building problem-solving capacity. So, we have been doing this officially since September. We announced via press release, I believe in November or December. So some of this is already acting, but we're receiving coaching to apply quality improvement science, a method for problem solving to improve how our houseless response systems operate. HMIS and coordinated entry. And we also receive tools to fully leverage our real-time data and whether our efforts are working. And we're preventing houselessness and disrupting inflow is the next goal. So by the time someone experiences houselessness, they're likely to have touched numerous other systems. This could include healthcare or housing systems or foster care, or possibly even the legal system. And the Built for Zero team is working with us to help understand how systems like these can work together to help us as a region here in Central Oregon minimize or stop folks from experiencing houselessness. And ultimately, we hope to close the housing gap, by utilizing the system to help with data, to data helps get funding, and ultimately bring new units into the system in a faster, cost-efficient and flexible way. So there's action cycles in this Built for Zero system, and we're currently in the improvement system shaper action cycle. And this cohort, which I'll elaborate on, is focused on building our team and just getting the data reporting process going. The next one, which we'll be into, we're going to move into, is called Shift Lab. And from there, we'll be building on what we've learned in the first cohort, but then also working on building our by name list, adding focus on developing parts of data and infrastructure that can strengthen our coordinated entry system. From there, we'll go to system flow, which is about speeding up the phases of coordinated entry and really looking at the inflow and outflow and folks experiencing active houselessness. And then the last mile is the cohort where we get there if we as a region, it has folks experiencing houselessness is, we're within the goal. And so that's why it's called the last mile. And, at this point we have certified quality data. Our coordinated entry system is amazing. And, it's when we're ready to hit functional zero within 6 months. So just wanted to share a little bit of an idea of what the action cycle is. Obviously, I know the first one the best because that's what we're in currently. And so we have been in the improvement system shaper for, let's see here, for about 3 months, because we'll go through April, so 3.5 months. And the two main goals of this cohort is to build our improvement team, also known as the command center, which I mentioned in previous slides, and to report data. And it doesn't have to be, necessarily 100% quality data at this point. We're just like learning to hit certain areas and, include certain data to help like really see what's going on with our inflow and outflow, and, referring to folks that are coming into services and out of services. So I'm happy to report that we have been reporting data. So we have that goal and we have part of our improvement team. And I'm going to elaborate on that and also do a call for folks to be involved in this work. Timeline so far. So we kicked off our cohort. Let's see here. On the 1st of November, and we started building our team and, learned what we were gonna do in the improvement system shaper cohort, which we're currently in. And we also in November started learning what we were to report on and had a reporting orientation. We work with Jane Moy from Built for Zero for data, and our coach is a woman named Eliza Keel, and they're both amazing and fabulous, and we're really grateful for their coaching. In December, we had an all cohort meeting and a small cohort meeting, and that's generally what happens each month. And so the work that we covered in December was, let's see here. We started discussing barriers to stakeholder engagement, and we also worked on best practices for getting folks involved with the idea of a by name list, which we already have in some form with our coordinated entry. And then in January and February, we have had some really amazing sessions that have included work around outreach mapping, which I'll explain in a moment, but it just kind of, we've been really looking at our systems and they've been assisting us in a way that helps us engage and see like actively how things are working and where there's an opportunity for improvement. And so it started out with a scorecard, which actually the folks who helped decide if this was going to be a good opportunity and movement for our region to be involved in, they just kind of scored where we are with outreach and different metrics, and who's involved in data gathering, how many folks are utilizing HMIS, things like that. We've also looked at possible providers and who touches folks who are experiencing houselessness. So you can see it includes medical, there's Deschutes kind of behavioral health. This goes beyond this. And, we were even talking about probation and parole, folks who are in that work in the forests, things like that. And all of these work sessions and these examples of work exist in something called our Central Oregon, as you can see in the corner, project portfolio. And as I said, I'm kind of temporary and current in this improvement lead role, and I'm really excited to share that Caitlin will be taking this over, and more on that later. But I have a feeling that she'll be organizing, getting folks more involved so we could make sure our workbooks and the work that we've done so far is like really up to par. And then this is an example of outreach mapping, which was really great because when we worked on this, we had a lot of folks in outreach present. We had, for instance, like Bob Bohack from Redmond present, and it was just really great to have folks that were actively doing outreach be part of this conversation. But as you can see, like there's a lot of stuff that we could still refine. I'm sure we'll come back to this later, but it's just really great to start, putting work to paper and being able to really map out what's happening in our region. And we just recently did data mapping. I know this is huge and really tiny, but I just wanted you to see like pathways that Jane helped us look at about the way that we collect data, what we're capturing, and just really seeing where there's gaps. And so that was a really incredible session, as was process mapping. And this was really great. I was not completely present for the whole session, unfortunately, but the folks that were present, did great work looking at agencies and individuals that work on access, assessment, matching, housing navigation, assets, stabilization. And then over here in this corner, which, too small to see, we had isolated some next steps. And, it's really exciting to be able to see this happening in real time and being able to identify like real tangible next steps. And so we're just really excited for this work. So as I mentioned, the goals of the cohort are report data and also build our improvement team. And I just wanted to show you that these are the roles on our improvement team lead, data lead, senior sponsor leaders, key improvers, and also private public funding lead. And so as I said, it started out with Colleen Thomas. We know the great work she's done for our region and the collaboration with all of you amazing folks. And I took over as she was getting ready to go on leave. And Caitlin, who you all may know as our HMIS specialist, has recently moved into our coordinated entry generalist position, which means she'll be taking over, pretty much maybe by the end of this presentation, but no, she's transitioning, and we're really excited to have her on board. And so improvement team lead is someone who helps schedule, get folks involved, recruiting stakeholders, as we get the team built, starting to delegate. And so it's really the all hands wrangler. And really grateful for the work that Colleen did, and I'm really grateful for Caitlin coming on. So the data lead is also currently Caitlin because, she's our regional HMIS specialist and administrator. And I believe that, if you're not aware, it's been getting shared with the HLC newsletters that we are currently looking for a new HMIS specialist. If anyone is interested, let me know, we can send you information. But this is the person that is building and maintaining our system. So it's our HMIS, and it's also, touching on the coordinated entry. So it's really interesting that Caitlin is currently straddling both these roles. But it's the person that's able to pull data. She's currently the person that's doing our reporting for Built for Zero. And she's been working tirelessly with Hunter Belgard, who is the OHCS overall homeless management information system guru, and so they've been working on filling the holes that we have in regards to data, and so that's what we currently have filled, but also looking for someone who is going to be our new HMIS specialist. And also I want to really thank Chris. So not only is he amazing in helping with this HLC meeting, as Eliza mentioned, he is the representative from COIC, our local intergovernmental council, and they, because of their unique position within our region with stakeholder engagement and such, that is a role that they have decided to fill for us. So we're really excited for that. And then we have key improvers. And so, these are the folks that across the spectrum are doing work and touching on all folks experiencing houselessness. This is frontline staff, folks with lived experience, and then, folks from big providers. And that's not an exhaustive list, but just examples. And I want to thank Annie from Bethlehem Inn, and also Lindsay Staling, who is vice chair of HLC, for their commitment and involvement as key improvers. But we officially, of course, if we can get as many as possible, that would be great, but officially have 13 open key improver roles. So the goal is to have 15. And like I mentioned a few folks, but, you could review this list and see, like, we're looking for folks to be involved who, and I'll talk about time commitment and capacity in the coming up slides, but we're really looking for folks to commit to being a key improver, to being involved with Built for Zero. If it's someone who is in city or county leadership, or if it's someone involved with veteran work or outreach, and like this list is not exhaustive, just folks who touch the lives of people experiencing houselessness. We would love to have you involved and committed as part of this movement and work for our region. We additionally have the private public funding lead open, and I was, this might be a circle back because sometimes both this and the sponsor role lead, sometimes it could be the same. So this might be a circle back with COIC, but we're just looking for a leader in the region, who understands local funding and strategies, and kind of have their hand in the pot and know all the moving parts of funding. And, so we're looking for key improvers, and we're looking for a private public funding lead. And so I've highlighted, the involvement for, I highlighted senior leader, but so private public funding lead and key improvers, we ask that they are able to participate in all cohort calls, which is 1 call a month, and that's an hour and a half. And I'll detail that in a moment. Key improvers, small groups, depends on the content. Work sessions, depends on the content. And then case conferencing ultimately is the end goal, but we might not be there yet for some providers. So, key improvers, we would love for them to be in all cohort calls. And we would love for them to, participate depending on the content in small groups and work sessions. And same with the private public funding lead. It could be dependent on the content of the work session, and then also all cohort calls. So what's the commitment? Key improvers, 2.5 hours is the more likely, up to possibly 5, depending on work sessions. Like for instance, we had process mapping extra in January, and then we had data mapping already this month. So that added an hour to the normal 1 hour small call and 1.5 hours large call. And as you can see, all cohort calls are the second Wednesday of each month from 12 to 1:30. In case conferencing, So this is something that maybe not everyone is ready to participate in, but that is the ultimate goal as we refine that process through this Built for Zero movement and method, that you eventually as a key improver are part of that, because we really want you to be part of improving the data so that we can best serve folks in our region. And then as appropriate, small calls and work sessions. And with the private public funding lead, an hour and a half, if you just attend the all cohort call, it could be, maybe 2.5, 3 hours per month, depending on the work that we do, that I was talking about, like outreach mapping and data mapping and things like that. So, if you're interested in joining us as part of the team, if you would like more information, if you'd like one-on-one presentation, I'm gonna say call Caitlin. Even though I've been doing this presentation, as I said, she's really moving into this role. I'm here to help support her, and I can share my information as well, but she's super excited, and I know she's already been setting up meetings with local providers. So, here is her office line and her email, which I can also pop into the chat. And if you've been asking questions all along, I'm so sorry I couldn't see it because of the presentation, and I'm not sure where we're at with time, but would love to take questions as allowable. And thank you so much for having me.
Thank you, Dana. As someone who's been participating in the cohort, I have to say that, all of especially the most recent meeting that we had doing mapping with other providers, it's really cool to see, the steps in implementing things and where we can grow and change and make things better, and that we're already kind of doing those things. So we're already kind of heading in those directions, and that was exciting to see in the last meeting. I think I didn't see any questions in the chat, so we'll move along. If you have questions, you can pop them in there just for time's sake, and we'll answer them in there. If we have time at the end, we can try to have a little bit of discussion. We'll move along to Shana Falb. She's the Equity and Inclusion Coordinator at Deschutes County Public Health.
Hi, sorry, just trying to locate the right screen here. All right, thanks for having me. Can everybody see and hear me?
Yep. Thank you for coming.
Yeah, thanks for having me. So I am the Equity and Inclusion Coordinator at Deschutes County Health Services. I started back in September, and I'm almost fully deployed to COVID response. Part of those responsibilities are managing our BIPOC COVID-19 outreach team, as well as our COVID wraparound services team and the isolation motel. This is my first time at one of these meetings, and it's so awesome to see so many people involved in these really necessary causes. I recognize a few names out there, so thanks so much for having me, and I'm honored to be part of this incredible coalition today. So the isolation motel is part of wraparound services, and it was just recently transferred under my supervision from the behavioral health department to the public health department. So for those who don't know, the isolation motel is located at the Budget Inn on the south side of Bend, and it is where we place COVID positive folks who are experiencing rural homelessness so that they can safely isolate and prevent the spread of COVID. Our team of 5 wraparound staff works 7 days a week during normal business hours, and we also have security on site after hours who can receive referrals from providers and community partners to check people in. Looks like one of those team members, Lori Henning, is also on this call. So thanks for joining, Lori. The guidelines around isolation and quarantine have changed quite a bit over the last month. And as we all know, they can be really difficult to navigate these days, just in general, but then especially in the work that we all do day to day. So I wanted to bring some clarity to the congregate setting guidelines and just try to make these changes a little bit easier to navigate for everybody. Since they've now been in effect for a couple of weeks, you may all feel a little bit more comfortable, but if not, I hope this helps. So I really want to make sure that we're all working on the same guidelines. So for congregate settings, unlike the 5-day isolation and quarantine that the CDC recommends for the general population, they are still recommending a 10-day isolation and quarantine for folks in these congregate settings, including those experiencing houselessness, regardless of vaccinations status. And this is the same guideline that we're using for the county's isolation motel. So day one of isolation would be the first full day after symptoms have developed or a test specimen was collected. So for example, if somebody was experiencing symptoms on January 1st and they don't test till January 3rd, the isolation period should still begin January 1st, plus an additional 10 days. They can stay at our isolation motel for the entirety of those 10 days and then released back to their previous shelter or housing situation. We are able to extend that room for additional days if somebody is still experiencing symptoms until those symptoms have resolved. So that would be 24 hours after the fever is gone without the use of fever reducing medications. And then their other COVID symptoms are improving. We do also temporarily house folks awaiting test results for up to 3 days while they await those results. And then if those results end up positive, we would continue that time for those total of 10 days. So we just really want to make sure we're syncing up here so that we're not releasing folks from isolation, not back to a bed that they would have had at a shelter. We just want to make sure that those folks are staying housed. I can also go over our protocol at the isolation motel a little bit, just to make sure that everything is clear. So those motel placements are not meant for medical care. So somebody who is needing medical care should not be referred to us. We don't have any medical providers on site. It's also, unfortunately, not ADA accessible, so folks must be able to transfer independently. And so if they're in a wheelchair, they might have some trouble at the budget inn. So if you do encounter somebody who fits the criteria, so they're COVID positive, experiencing literal homelessness, we do want that a signed guest agreement prior to coordinating that motel room, just to make sure that they are willing to isolate and follow all the rules on that guest agreement. So we have those typical rules: no drugs, etc. We have no cooking equipment. We also ask for no visitors, no coming and going. Essentially, no physical or social interaction with anyone aside from healthcare providers or authorized service providers, and that is so that they can safely isolate when they're not spreading COVID. We do permit dogs, but they must be leashed when they're outside of the room, and we have a specific area where they can relieve their pets. I do want to mention that OHA's guidelines are in the process of being updated, of course, because they're always changing. And that is going to indicate that folks who are living in congregate settings, they must continue to isolate for 10 days, but they can return to work or school after 5 days. So this is something we're going to need to work on, because in the current state, our guest agreement does not allow for any coming and going of any of our guests. So we can't honor that ability to return to work or school after 5 days. I'm happy to discuss this further with you all to make sure that we're all on the same page if it seems like we should reconsider this rule. But as of this day, as of this time, we're not able to honor that future rule change of comings and goings to work or school after 5 days. In order to get us that guest agreement, you can email that to us. If you don't have our email address or contact information, I can get that to you. After we get that guest agreement, we ask that you please call us to let us know that you have somebody to isolate. We'll need the individual's name, any contact information that you might have, the date of first onset of symptoms or date of positive test result, any accessibility or dietary needs, so we can get them food that works for them, as well as the current location where they're at. Once we verify that that guest agreement has been reviewed and that they agree to those rules, we can get them, we can have that conversation and make sure that they meet our criteria. And then you would be responsible for transporting the individual to the isolation motel. I do want to emphasize that they should not ever go to the motel front desk for a room key. That room key will be placed in a location where they can access it without having contact with the motel front desk, because we're just trying to minimize that spread. When folks do arrive, they'll receive a food box with food for about 3 to 4 days, and then another food box on Fridays. There is a microwave and a fridge in the room, and then they also receive 1 hot meal per day while they're there. As we know, these guidelines do have a tendency to change quickly and without warning, and we're often not updated on those until the same time you are. So I'll do my best to keep you all updated on any of those changes to our protocols and guidelines that we're following. If you need me to email our protocol to you or our guest agreement to you, please feel free to drop your email in the chat and I'll get it out to you. Otherwise, feel free to reach out to me or our team with any questions that you have. And again, I'm really open to keeping these lines of communication open to make sure that we're all on the same page and we're serving folks as best we can. So if there's any information that I should know from you all that would help us at the isolation motel or with the wraparound team, please do reach out or even let me know right now if you have, if we have time. So that concludes everything. Thank you so much. I haven't looked at the chat at all, so I don't know if there's any questions in there for me.
It looks like you have one question so far. The question is the isolation contract still for the Tri-County, or is this resource exclusively for those in Deschutes County?
That is a fantastic question that I should probably know.
As far as I know, in my
Oh,
history of
thanks,
doing this, sorry, it's just Deschutes County at this time. Residents of Deschutes County.
That's Lori. She's on the isolation motel team. Thank you so
Sorry,
much.
I guess I didn't
answering.
introduce. Yeah.
And I do have a question, and maybe I should know this. I feel like I should. If we have someone in our shelter that tests positive for COVID, are they able to go to the isolation motel? Okay.
Yeah, absolutely. That's what we're here for. So if they don't have a way to safely isolate from everybody, so essentially that means they'd have their own bathroom and their own kitchen potentially, so that they don't have any shared spaces, then yeah, absolutely refer them to us so that we can isolate them and you don't have an outbreak at your facilities.
Are you guys doing pretty good with having available like openings when people are reaching out?
That fluctuates greatly. So currently we have space. We have, I'd say about 6 or so rooms available. That might change dramatically by the end of the day. I will say that about a week or so ago, we were nearly at capacity and really concerned about where we were going to be able to place more people. So over the last week, that's kind of slowed down a bit, thankfully, but we do currently have space. So I just reach out to Lori or the team just to make sure that we have some space to place your folks.
Great. Do we have any other questions? Okay, so I just have a brief update for coordinated entry. Like Dana said earlier when she was talking about Built for Zero, we are super excited to have Caitlin Rogers as our new coordinated entry generalist. She is doing both roles right now, which she's amazing, and I feel really fortunate to have someone who has such a great background with data, because I feel like that's something that's super important for coordinated entry and also her background in training as well. So I think that's going to really be great for that role and benefit our community. Just to plug coordinated entry, we do have a hotline. I'm going to drop information in the chat about that. And it's open Tuesdays and Thursdays from 12 to 4. And so if you're wanting to refer any of your clients for the emergency housing choice voucher or rapid rehousing, we do have openings for both of those programs. And you just have them call that number if you don't have access yourself to Service Point and are able to put in their SPDAT and refer it in the system. We are also going to be doing intakes, like we're going to be pulling people from the coordinated entry list for the NeighborImpact shelter as well. So any providers who are referring clients who want to learn more about coordinated entry and want to attend the committee meetings, whether that's the planning for coordinated entry and you know, changing things in the system and updating things, those meetings, or the continuing case conferencing meetings, you can reach out to myself or Caitlin, and we'd love to meet with you and get you started. We're working on really doing some training, having training available for folks so that we can train folks before we include them in the meetings so that they are up to speed. And yeah, I think that's everything. So we can open it now up to like any community announcements that folks have, or if there are any new faces in the group that want to introduce themselves.
I have an announcement. So y'all may have heard or read in the paper, or like Eliza just mentioned, the property that will eventually be Project Turnkey here in Bend is opening as a temporary low barrier emergency shelter that is planned to go through May 31st. It's going to open this week, this coming up week. You know, we were aiming for Monday, but there's still a little bit of work that the city is doing. So it will be this coming week. And, you know, if folks will be, we have some rooms that are set aside for Shepherd's House per an agreement with the city of Bend and Shepherd's House. And so there'll be 25 rooms and about, or not about, up to 10 are reserved for the overflow of Shepherd's House because they have turned into a 24/7, sorry, 24-hour, 7-day-a-week shelter when it had, you know, been intended to be just an overnight shelter. So they've been operating beyond capacity, both in staffing and in space. And so going to have some of those folks come over, and then the rest will be coming from coordinated entry, as Eliza mentioned. So super important to make sure that folks who are experiencing houselessness, if they want to access non-congregate shelter to complete that SPDAT, also known as the housing assessment, which is the coordinated entry assessment. And it can be completed via phone on Tuesdays and Thursdays. And I will drop that in the chat unless someone gets to it faster. And it will also be phased entry because right now it's me. And I have a temp, hopefully a temp to perm coming in on Monday that I'll be training on Monday as we get ready to open, hopefully by Tuesday or Wednesday, but I will let everyone know. And, you know, tomorrow's meeting for coordinated entry will be extra special and important. Besides its normal specialness and importanceness, is to make sure that we can get folks that may have expressed interest that you're working with moved over to the possibility of being in the wait list or the access list for Division Street Shelter. So I hope that helps explain some things. Oh, there has been some confusion. So there are 25 rooms, so essentially 25 households. The papers have been reporting 40 beds, so I know that's where confusion has been in. There are actually, how many beds? Oh yeah, I think that's right. So essentially there could be up to, so there's 5 rooms that have 2 double beds. So that would be, can I do math? 10 spaces. Nope, no, there's 2 double beds. So that'd be 20 spaces. And then the other 20 rooms just have 1 double bed. So there could be up to 60 beds, but just 25 households. So they haven't been 100% reporting correctly, but you know, that happens sometimes, so.
And it looks like you have a few questions in the chat from Johanna. about that. So during the CES case conferencing meetings, we'll be recommending, can we recommend individuals and families for the shelter? Yes. Yep.
Yeah,
Eliza-
because
Eliza-
yeah, so just making sure that they have that SPDAT. And so the qualifying SPDAT, Johanna, regarding your question, on the match form, there is now a question that I know at least is in the Homeless Management Information System. I don't know if the match form has been updated on our HLC website, but that it has the question of, are you interested in non-congregate shelter? And they're also expanding on, you know, are you interested in the programs we have available, so that they have individual choice rather than, I think this would be great for them, you know, as providers.
A couple quick updates from Redmond. Most immediately, our shower van arrived within the last week and should be back out and operating. Not today, there's still work being done on it, but within a week or 10 days. We have 3 locations in Redmond that we hope to get it to immediately. Also, I would like to thank Eric specifically, but the Deschutes County Commissioners, they've approved $367,500 for Oasis Village to become real, hopefully within the next year, to no more than a year and a half. Oasis Village is currently working with Rogue Retreat. We're in the process of getting some assessment tools. Many of you will be hearing from us within this month's time frame to get that going. We're trying to do for Redmond what was done with the emergency task force for Bend, trying to get a master plan for what's called the East Redmond Project, 10 acres out along Highway 126 for different shelter forms and wraparound services. So many of the service providers will be part of what we're trying to accomplish going forward. Thanks.
Great. Thank you. And then I think we have a few other questions for you in the chat, Dana. How long individuals can stay at the shelter?
It's a great question. So it's for an initial 30 days with the possibility to extend. You know, so the shelter is only, at least as in this iteration, is only planned to be 4 months or slightly less, because we're now into February. But you know, just want folks to, within their capacity, within, because it's going to be strengths-based, you know, case management and programming, where it's not going to be like, you know, you have to do this. It's going to be what within, you know, what you hope to achieve, you know, working towards housing and just making sure that they're engaged with program and stuff like that. And so just that it gives them the opportunity to be extended. Of course, obviously, as long as they're helping to maintain a safe space and following guidelines and stuff. So 30 days with the option to be extended, if that helps.
Great. And Molly popped in the chat that the ESG grant funds, the request for, let me look, what did she say? Request for proposals are being released today. So you can find that on the NeighborImpact website
and also on the HLC website.
Yep.
Our compliance manager, Jeff Michael is the person to connect with about questions. I put his email in the chat. It's also in the ESG RFP. And if you are a returning proposer, we are sorry for the delay. And if you are new to the game, please reach out with questions. We encourage as many applicants and proposals as possible. And this is always scored and prioritized in collaboration with the Homeless Leadership Coalition Board, as emergency solutions grant money is connected and intertwined with the continuum of care.
What's the deadline, Molly? What's the deadline?
Sorry, I was really eager to get off camera. It's due on February 16th, and then we're going to make sure we notify by March 4th. It's all in the RFP, and so you know, this is a really delayed cycle. COVID has pushed back the state processes and our process inherently, but these funds are allowable for reimbursements back to July 1 of 2021. And the end term is 6/30 of 2022. So we would hope to offset some of your costs that you may have already obviously paid, but so that's going to be a process that we'll all have to work through together, but happy to do that with you.
And I believe this is separate from Bob's announcement, but Dawn put in the chat that Jericho has got their shower van up and running. Yeah, that's exciting. People will be clean and tidy pretty soon, as Dawn said. Thank you, Dawn. There's lots of other updates in the chat. So from Pandemic Partners, Mosaic Medical. I also dropped in the chat, there's a local nonprofit called the Fathers Group, this is kind of separate from, kind of what we do, but it all aligns, that's doing their website. I put it in the chat, but they're doing a film series for the next couple months and hopefully ongoing. That's great, and you guys should check out. They're also doing an after-school program on Wednesdays that my children attend, and is a great opportunity for children of color to connect with other children of color in the community, and also learn about their heritage and music and hair and body image stuff. So it's really great for our kids. I think we're about at time.
One more announcement. Homeless Leadership Coalition has invested again in Niche Academy and the Ryan Down trading modules. So these are on demand, anytime, available to anybody in our continuum at no cost to you. It is paid for by like planning grant funds and membership dues. We have not seen as much traction in utilization, right? So Tara, myself, anyone who emails info@cohomeless.org can get their email added and go check it out. And we send out a lot of, hey, you're signed up, you can take these trainings whenever you want to. What I'm not seeing is actual participation in those trainings. So we did renew another year because it is new, and the last year and a half has been really tough to find time to do anything extra. But we won't be able to keep renewing this if we don't see utilization. So please extend it to your volunteers, to your staff. And if you've got any questions about it, reach out to info@cohomeless.org, and really, really solid, amazing trainings that you can kind of do as part of staff meetings or one-on-one, and chunk it out. It's really easy to follow in short segments as well. Thank you.
Lindsay, what was the site again?
It's our Ryan Dowd Niche Academy, but you need an invitation and login, Dawn. So if you're curious about it, I email info@cohomeless.org to request access, and I can get you set up. And Tara at the Bethlehem Inn is also able to set people up.
Thank you.
Lindsay. All right, I think we're going to call it a meeting for today. Thank you guys so much for coming this early morning on a Friday. Our next meeting will be March 4th at the same time, 8 a.m. And I hope you guys have a good rest of your month.